10th Standard Science Unit 21 Health and Diseases இந்த லெசன் ஒரு புக் பேக் ஆன்சர்ஸ் பார்க்கலாம். அதுக்கு முன்னாடி சப்ஸ்கிரைப் பண்ணாதவங்க சப்ஸ்கிரைப் பண்ணுங்கள், லைக் பண்ணுங்கள், ஷேர் பண்ணுங்கள், கமெண்ட் பண்ணுங்கள். First Roman letter, choose the correct answer. First one, tobacco consumption is known to stimulate secretion of adrenaline. The component causing this could be answer option A, nicotine. Second one, World No Tobacco Day is observed on option A, May 31st. Third one, cancer cells are more easily damaged by radiations than normal cells because they are option D, undergoing rapid division. Answer option D. Fourth one, which type of cancer affects lymph nodes and spleen? Answer option D, lymphoma. Fifth one, excessive consumption of alcohol leads to option B, answer cirrhosis of liver. Sixth one, coronary heart disease is due to option D, answer insufficient blood supply to heart muscles. Seventh one, cancer of the epithelial cell is called option C, carcinoma. Eighth one, metastasis is associated with option A, answer malignant tumor. Ninth one, polyphagia is a condition seen in option B, answer diabetes mellitus. Tenth one, where does alcohol affect immediately after drinking? Option D, answer central nervous system. Second Roman letter, state whether true or false. If false, write the correct statement. First one, AIDS is an epidemic disease. The statement is true. Second one, cancer causing genes are called oncogenes. The statement is true. Third one, obesity is characterized by tumor formation. The statement is false. The correct statement, cancer is characterized by tumor formation. Fourth one, in leukemia, both WBCs and RBCs increase in number. The statement is false. The correct statement, in leukemia, WBC increase in number. Fifth one, study of cause of disease is called etiology. The statement is true. Sixth one, AIDS is not transmitted by contact with a patient clothes. The statement is true. Seventh one, type 2 diabetes mellitus result due to insulin deficiency. The statement is false. Correct statement, type 2 diabetes mellitus results due to low activity by insulin. Eighth one, carcinogens or cancer causing agents. The statement is true. Ninth one, nicotine is a narcotic drug. The statement is true. Tenth one, cirrhosis is associated with brain disorder. The statement is false. The correct statement, cirrhosis is associated with liver disorder. Third Roman letter, expand the following abbreviations. First one, IDDM. Second one, HIV. Third one, BMI. Fourth one, AIDS. Fifth one, CHD. Sixth one, NIDDM. First one, IDDM, insulin dependent diabetes mellitus. Second one, HIV, human immunodeficiency virus. Third one, BMI, body mass index. Fourth one, AIDS, acute immunodeficiency syndrome. Fifth one, CHD, coronary heart disease. Sixth one, NIDDM, non-insulin dependent diabetes mellitus. Fourth Roman letter, match the following. First one, sarcoma, connective tissue cancer. Second one, carcinoma, stomach cancer. Third one, polydipsia, excessive thirst. Fourth one, polyphagia, excessive hunger. Fifth one, myocardial infarction, lack of blood flow to heart muscle. Fifth Roman letter, fill in the blanks. First one, cirrhosis is caused in liver due to excessive use of alcohol. Second one, a highly poisonous chemical derived from tobacco is nicotine. Third one, blood cancer is called leukemia. Fourth one, less response of drug to a specific dose with repeated use is called tolerance. Fifth one, insulin resistance is a condition in diabetes mellitus type 2. Sixth Roman letter, analogy type question. Identify the first words and their relationship and suggest a suitable word for the fourth blank. First one, communicable, AIDS, non-communicable, answer diabetes mellitus. Second one, chemotherapy, chemicals, radiation therapy. The answer radiation. Third one, hypertension, hypercholesterolemia, glycosuria. Then answer hyperglycemia. Seventh Roman letter, answer in a sentence. First one, what are physiotropic drugs? Answer, there are certain drugs called physiotropic drugs which act on the brain and alter the behavior, consciousness, power of thinking and perception. Second point, they are referred as mood altering drugs. Second question, mention the diseases caused by tobacco smoke. Bronchitis, pulmonary tuberculosis, emphysema, mouth cancer. Third question, what are the contributing factors for obesity? Answer, genetic factors, physical inactivity, eating habits, endocrine factors. Fourth question, what is adult onset diabetes? First point, type 2 non-insulin dependent diabetes mellitus is called adult onset diabetes since one of the major causes is increasing age affecting middle-aged and elder people. Second point, it develops slowly and later becomes stable. Fifth question, what is metastasis? The cancerous cells migrate to distant parts of the body and affect new tissues. Second point, this process is called metastasis. Sixth question, how does insulin deficiency occur? In the case of type 1 insulin dependent diabetes, the beta cells of the pancreas get destroyed. Option A, this result is deficiency of insulin produced by the pancreas since the beta cells produce insulin. Option B, hence it leads to elevated glucose level in the blood. In the case of non-insulin dependent diabetes mellitus, insulin production by the pancreas is normal but its action is impaired. Thus, in both cases, deficiency of insulin is observed. Ninth Roman letter, short answer questions. First one, what are the various routes by which transmission of human immunodeficiency virus takes place? HIV is transmitted generally by option first, sexual contact with the infected person. Second point, use of contaminated needles or syringes. Third point, by transfusion of contaminated or infected blood or blood products. Fourth point, from infected mother to her child through placenta. Second question, how is a cancer cell different from a normal cell? Cancer cell, normal cell. First point, the size of the nucleus is large. Then here they have normal small sized nucleus. Second point, the nuclei are very prominent. Here the nuclei are less prominent. Third point, they can multiply indefinitely. They have fixed rate of multiplication. Fourth point, they invade surrounding tissues. Here they do not invade surrounding tissues. Here fifth point, they remains less differentiated. Here they are well differentiated cells. Third question, differentiate between type 1 and type 2 diabetes mellitus. Factors, type 1 insulin dependent diabetes mellitus IDDM, type 2 non insulin dependent diabetes mellitus NIDDM. Then prevalence 10 to 20% is to 80 to 90%. Age of onset, juvenile onset is greater 20 years. Then maturity onset less than 30 years. Body weight normal or underweight, obese. Defect insulin deficiency due to destruction of beta cells. Target cells do not respond to insulin. Treatment insulin administration is necessary, can be controlled by diet, exercise and medicine. Fourth question, why is a dietary restriction recommended for an obese individual? Eating habits are a major causes for obesity. Overeating. First point, diet management. Low calorie, normal protein, vitamin and mineral. Restricted carbohydrate and fat. High fiber diet can prevent overweight. Second point, calorie restrictions for weight reduction is safe and most effective. Fifth question, what precautions can be taken for preventing heart diseases? First point, diet management. Reduction in the intake of calories, low saturated fat and cholesterol rich food, low carbohydrates and common salt are some of the dietary modification. Diet rich in polyunsaturated fatty acids is essential. Increase in the intake of fiber diet, fruits and vegetables, protein, minerals and vitamin are required. Second point, physical activity. Regular exercise, walking and yoga are essential for body weight maintenance. Third point, addictive substance avoidance. Alcohol consumption and smoking are to be avoided. Ninth Roman letter, long answer question. First question, suggest measures to overcome the problems of an alcoholic. Answer, first point, education and counseling. Education and proper counseling will help the alcoholic to overcome their problem and stress, to accept failure in their life. Second point, physical activity. Individuals undergoing rehabilitation should be channelized into healthy activities like reading, music, sports, yoga and meditation. Third point, seeking help from parents and peer groups. When a problematic situation occurs, the affected individual should seek help and guidance from parents and peers. This would help them to share their feelings of anxiety, wrongdoing and get rid of the habit. Then fourth point, medical assistance. Individuals should seek help from physiologists and physiotherapists to get relieved from this condition and to lead a relaxed and peaceful life. Fifth point, alcohol de-addiction and rehabilitation programs are helpful to the individual so that they could get rid of the problem completely and can lead a normal and healthy life. Second question, changes in lifestyle is a risk factor for occurrence of cardiovascular diseases. Can it be modified? If yes, suggest measures for prevention. Cardiovascular disease is associated with the disease of the heart and blood vessels. The risk factors for coronary heart diseases are hypercholesterolemia, high blood cholesterol and high blood pressure. Hypertension are the major causes. If the untreated, it may cause severe damage to brain, kidney and eventually lead to stroke. Causes: diet rich in saturated fat and cholesterol, heredity, family history, obesity, increasing age, then cigarette smoking, emotional stress, sedentary lifestyle, excessive alcohol consumption and physical inactivity are some of the causes. Those changes in lifestyle are an important factor for occurrence of heart diseases. It can be modified by conscious efforts such as, first point, eating healthy food rich in proteins and carbohydrates and avoiding junk foods. Second point, avoiding food items rich in cholesterol. Third point, avoiding sedentary lifestyle at home and workplace by indulging in lot of physical activity. Fourth point, avoid smoking, alcohol consumption. Fifth point, go for regular medical tests to determine the blood cholesterol level and related body functions. Sixth point, eating habits must be regular and food must not be compromised. Then seventh point, lot of fresh fruits and salads included in the diet can help to remain healthy. 10th Roman letter, higher order thinking skills. First question, what is the role of a fat in the causes of atherosclerosis? First point, fatty substances such as cholesterol get deposited in the blood vessels from childhood. Second point, it starts from a fatty streak and develop into a fibrous complicated plaque. Third point, this lead to the narrowing of blood vessels leading to atherosclerosis in the large and medium sized arteries that supply the heart muscle with oxygen. Then fourth point, it lead to ischemia, the deficient blood supply to heart muscle, and myocardial infarction, death of the heart muscle tissue. Second question, eating junk food and consumption soft drinks results in health problems like obesity. Still, children prefer. What are the suggestions you would give to avoid children eating junk food or consumption of soft drinks? First point, children must be given healthy food from childhood and healthy snacks must be given to them so that they develop to taste for the same from a young age. Second point, they can be given fruits juice, sugarcane juice, etc. instead of cool drinks. Parents must also adhere to this. Third point, as they grow up, they can thought about the negative impact of junk foods and cool drinks. Fourth point, even in schools, teachers advise parents to send healthy snacks instead of chips or other junk foods. Fifth point, though children will find it difficult to avoid junk food or cool drinks because of advertisement, influence of friends, etc., we should make a conscious efforts to create awareness among students. Third question, regular physical exercise is advisable for normal functioning of human body. What are the advantages of practicing exercise in daily life? Answer, regular physical exercise can give the following benefits. First point, it helps to burn calories and bring about weight loss. Obesity can be avoided by exercising regularly. Second point, it brings about changes in the brain which can reduce stress and anxiety due to production of certain hormones. Third point, it increases energy level in the body. Fourth point, it is good for the muscles and bones. Fifth point, it brings in a lot of positive thoughts and help fight depression. Then sixth point, it can reduce the risk of chronic diseases. Fourth question, a leading weekly magazine has recently published a survey analysis which says that number of AIDS patients in the country is increasing day by day. The report says that the awareness among the people about AIDS is still very poor. You are discussing the magazine report in your class and a team of your class decides to help people to fight against the dreadful diseases. Option A, what problem you face when trying to educate the people in your village nearby your school. Then option B, how do you overcome the problem? Option A, answer. First point, people in the village may not easily understand the scientific concept and use of vernacular language will be required. Then second point, they may not be willing to cooperate. Then third point, it may be a sensitive issue to educate them regarding safe sex. Then option B, answer. This problem can be overcome by identifying some responsible people in the village such as panchayat body or NGO workers or some educated people who will understand the issues and convenience people to cooperate with us. Film shows can be screened regarding the diseases which will have a better impact on the people. Then Roman letter 11, value based questions. First question, once a person starts taking drugs or alcohol, it is difficult to get rid of the habit. Why? Person who consume these drugs become fully dependent on them. They cannot live without drugs. This condition is referred as drug dependence. Physical and mental dependence. dependence on the drug for normal condition of well-being and to maintain physiological state. Then second point, physiological dependence, feel that drugs help them to reduce stress. Second question, men addicted to tobacco lead to oxygen deficiency in their body. What could be the possible reason? First point, smoking can lead to inflammable of lungs, alveoli and decrease the surface area of a gas exchange. Then second point, carbon monoxide of tobacco smoke binds to hemoglobin of RBC and decrease it. Oxygen carrying capacity causing hypoxia in body tissues. Third point, therefore men addicted to tobacco will suffer from oxygen deficiency in their body. Third question, name any three foods that are to be avoided and included in the diet of a diabetic patient. Why should it be followed? Foods to be included in the diet of a diabetic person are, first point, whole grains. Second point, green leafy vegetables. Third point, unpolished rice. These foods are rich in fiber content, protein and have low carbohydrate content. Foods to be avoided. First point, fruit juice. First, sweets. Second point, starchy vegetables. Third point, milk. They are rich in carbohydrates. Carbohydrates break into glucose in blood faster than other type of food and raises blood sugar level. Hence, diabetics should go in for protein rich food or food rich in fiber content. Fourth question, how can information efforts change people's HIV knowledge and behavior? Efforts to share information about AIDS included. First point, creating awareness by campaign and educating people on the consequence of AIDS. Second point, helping people to gain knowledge about the causes and risk factors regarding the diseases. Those will help them to prevent the spread of the disease by option first, screening of blood from blood bank before transfusion. Second point, ensuring that only disposable needles and syringes are used in hospitals and clinics. Third point, advocating measures for safe sex. 12th Roman letter, assertion reasoning. In each of the following question, a statement of assertion is given and the corresponding statement of reason is given just below it. Of statements given below, mark the correct answer as first one, assertion. All drugs act on the brain. Reason, drugs disturb the functioning of the body and mind. Answer option A. If both assertion and reason are true and reason is the correct explanation of assertion. Second question, assertion. Excretion of excess glucose in urine is observed in a person with diabetes mellitus. Reason, pancreas is unable to produce sufficient quantity of insulin. Answer option A. If both assertion and reason are true and reason is the correct explanation of assertion. Lesson over. Thank you for watching.